Hi guys, Audrey Jean here. How are you doing? I hope you're having a fantastic day. I sure am. The last video I did was about my job suspension. I'm still on suspension, but I wanted to try and get another video out. I'm doing much better today. Yesterday I was kind of ho-hum, but today I'm back to my regular self. I filled all my meds and got everything taken care of. So today what I wanted to talk to you about is medications. And the reason this is so important to me is because I happen to have a lot of knowledge on this subject. And when people tell me they're bipolar and they're on one medication, I am a little dumbstruck. If that is what works for them, that's great. But I am actually on quite a few medications. I'm on a mood stabilizer. I'm on a antidepressant, an SSRI antidepressant, because I get so depressed and I'm a rapid cycler. So I really need to have that antidepressant on board. And then I take an antipsychotic, the Seroquel, and that just helps me kind of with this line. Just kind of stay here. Because when I'm hypomanic, which I have been for quite some time, because like I said, I've had 3 jobs in the last 6 months, so I haven't had a stable to get insurance until recently. So like I said before, if you didn't watch my other video, my doctor filled my prescriptions for 2 months, but for the last 4 months, I've just been going on what I had, and then I went to a general practitioner and she's like,
"You are on too much. You can't be on this. You can't take this.
Antidepressants are contraindicated for bipolar, blah, 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 blah." And I said, well, I've been on these medications for quite some time, and I'm talking like a couple of years, and this is what works. But I also have a dual diagnosis. And if you don't know what a dual diagnosis is, that's 2 diagnoses of mental illness. I have PTSD. I got very agoraphobic. I had to stay home, stay in my room, stay in my little cocoon, which I tend to be pretty agoraphobic anyway. I like to stay home. I don't like to go do a whole bunch of stuff. I'm not really a person who goes out. So I'm on a mood stabilizer. I have some risperidone left, and she told me to go ahead and help me with that, because along with the PTSD, I was having bad nightmares. I'm doing so much better now, but I have been on a lot of medications. So when I went to the general practitioner, and I was a cash pay, so she really wanted to take down all my medications, because a general practitioner freaks out when they see you're on 8 different medications, 3 of which are benzodiazepines. And if you don't know what a benzodiazepine is, Klonopin, temazepam, Xanax, those are your anti-anxieties. And people with PTSD have an enormous amount of anxiety. And I had it so bad I couldn't even sleep. I'm now off the temazepam at night, but I am on the Klonopin 3 times a day. And she had taken me off so many of the medications that I wasn't sleeping well at all. Like, I'm talking 3-4 hours a night of sleep. And for someone who's bipolar, that is just not viable. That's not an option whatsoever. So I lived at this hypomanic state that I was just like angry all the time. Do you just feel like you can't help it? You just spew this vomit, and I have no remorse. No remorse whatsoever. And I was doing it to people at work. I was very bitey and just sharp-tongued, and then I walk away and I don't care. And that's not a good way to be. That's not a functional way to be, especially in a work environment. You have to be a team player and work together. So I was on less medication and trying to deal with this dual diagnosis. Although my PTSD was settling down, my bipolar was in full swing with this kind of hypomania. So when I talked about going into a full-blown manic episode. That's probably a really weird thing for me, but I just can't. After I had my full-blown manic episode, I was so photosensitive. I was wearing sunglasses in the house. the after effects of the photosensitivity, he didn't even ask me like, why are you wearing sunglasses? He just left me alone because I was so down and so mentally exhausted. It literally felt like I ran 3 marathons in a row. And I understand that that's pretty typical after a manic episode, and I just haven't had one in so long. But the hypomania had really been there for quite a long time, and that was due to the medication issue. This cocktail that I had, which I think everyone who's on medication has to find the right cocktail. Maybe you are a person who does really well on one medication. God bless you. You are so lucky, and I bow down to you. But the maddening thing for so many people that do have mental illness is you have to find the right cocktail. And the problem with that is these medications take time. Some of them take 4 weeks, up to 4 weeks. And then you either feel good or you feel bad and you're like, oh my gosh. And then the other problem is a lot of these antipsychotics and a lot of these mood stabilizers are weight gainers. So a lot of people don't want to take them because they gain weight. They feel better and they function so much better, but they're gaining weight and they don't want to gain weight. And I have been susceptible to that. Even though I'm very thin, I'm like, I won't take that because I gain weight. And lithium is the primary drug for bipolar, and I can't take that one because I have thyroid disease. Anyone with thyroid disease, those contraindicate those each other. So also, to go along with the thyroid disease, a lot of people who do have bipolar disease are also thyroid patients. But if you do have bipolar disease and you can't seem to figure out just maybe why medications aren't working for you, have your thyroid checked. So many bipolar patients have thyroid disease, and when you get that thyroid in check, I tell you, it is a blessing because you feel so much better. Put me on a low dose of thyroid, and that has helped immensely. So that's a helpful tip, that if you didn't know, a lot of bipolar patients are hypothyroid patients. So get that checked. It doesn't hurt anything, and you might be surprised. Along with hurting others, which I've never wanted to hurt anyone until I was a little hypomanic. And it wasn't that I was going to do it, I was just thinking about it. Because we can be suicidal as bipolar patients, but that doesn't mean you're going to do it. I've lived so many days just thinking life would be so much easier if I was gone. It would be so much easier on my children. It would be so much easier on those around me. It would be so much easier for me not to have to live this way. It is so hard for me to endure. I cannot imagine someone enduring this that is like my husband. He, God bless his soul, he puts up with this, and I've empowered him to go, if I'm acting not right, I've said, babe, just if I'm not being okay or I'm not being appropriate, here's some words for you. Have you taken your medicine today? And I tell him to ask me that. And if I say yes, then I've empowered him to say, do you need more medicine? And then that stops me to click and think, ooh, I'm not behaving well. I must need some more medication. And that doesn't make me angry. It doesn't make me feel like he's judging me, because I've given him these words and I've worked through this in therapy to trigger me that I'm not clicking on all cylinders and maybe I need some medical help in the intervention of medicine. So then I'll go take a Xanax and I'll take some time and calm down, and it works 100% of the time. Now, there are cognitive behavioral steps that you can take, and I want to get into those. And I want to ask you all, what do you do? What do you do when you're hypomanic? What do you do when you feel like you want to scoop somebody's eyeballs out with a spoon? I know that's not normal. No, that's nothing I would ever do. So please don't think that was something that crossed my mind, because I wasn't in a normal state of mind and I just wanted her to see how stupid she was being. But what do you do? Do you feel this way? Do you have these feelings in this hypomanic state, or maybe this semi-manic or even manic state where you're just so angry all the time and you lash out? Because I will tell you, it has cost me so many relationships. And this is a whole nother topic that I want to talk about, is relationships. And I'm not talking romantic relationships. I'm talking friendships, family, children, work relationships, every kind of relationship you can have. This disease has touched in my life. It has been nearly impossible for me to maintain healthy relationships because either I choose to back out of those relationships because they're not healthy for me, or that person chooses, she's kind of walking the line, and I don't think that's okay, and I don't want that in my life. So it's cost me dearly in my life with very important relationships. But I also have my own strong boundaries. But medications has helped so much with that I believe in them wholeheartedly. I have to take medicine in order to be okay. And I know this because of my field of study, that just like if you don't take your blood pressure pill, you're not going to maintain your blood pressure. And so many people have been on their blood pressure pill, then they feel better, then they go off, then they have an episode where they have to go to the emergency room because they're at stroke level blood pressure and they're starting to have symptoms. So I have always been very loyal to my medications when I can afford them, or I have to pick the ones that I'm going to take. And just this last year has really been the only time that I couldn't afford them or been off of insurance. So that's been a challenge, and it's been an eye-opening experience. So do you have to take medications, or are you able to do, the holistic approach where, because I think a lot of bipolar is a choice, and so many times if I would just slow down and think about what I'm doing and the choice that I'm making, which money is a huge thing. I am a spender. Oh my gosh, I'm a spender. Holy smoke and Moses. That's another topic I will talk to you about. Why didn't I justify to buy my medications? Because I justified buying other things that are more fun. And that's just, it's full circle. It's all about choices and that mind, that bipolar mind that says, well, you can do everything. And I know so many people go off their medications when they feel better. That is something I don't understand, just because of the field of study that I'm in my career. Because when you take a medication and it works, you have to keep taking the medicine or it's not going to work. And then you just keep doing and repeating the same lessons over and over and over again, and lessons repeat themselves until they're learned. So if you keep getting into trouble, or you keep having manic episodes, or you keep getting yourself into problems or situations, and you keep going off your medicine, so we have to control those things through medications. I hope that we can have a conversation and have a community that comes together, and we start asking questions, and we start saying, hey, do you do this? Or does this happen to you? And you tell me, no, this happens to me, and this is how I feel, because I want to know. I want to learn. I want you to learn. I want you to know what's normal and not normal, because there is no normal. But I want to know your experiences, because I want to know that I'm not the only one. Or maybe I am the only one doing this, and I need to look it up and research it, because I am big on research. And I want to learn from you, and I hope y'all can learn from me. What are you taking? What works for you? How many drugs have you been on? What has worked for you? What hasn't worked for you? How long did it take you to find the right cocktail? Are you even on the right cocktail? Do you have questions for what maybe could help you? Put it in the comments below. I want to hear. I want to know. Tell me if you think I'm nuts for taking everything I'm taking. I don't really care what you think, honestly, because I'm going to take what works. Are you a person who stops taking your medicine as soon as you feel better? If so, why? What is your motivation for that? I want to know why you would take something, feel better, and go off. I don't understand that type of thinking. And just please bring questions, bring comments, put it in the down box below. And hopefully if you find this any shape, form, informational or helpful to you, hit that subscribe button, and we can become a community and we can talk about these things. I'm Audrey Jean, and that's a wrap. Have a great day. Be blessed. Go out and be kind. Take care. Disclaimer alert, disclaimer alert. I am not a licensed mental health provider. I am in no way giving any advice or mental health information that is pertinent to you. I'm not telling you to go ask your doctor for anything. I'm not telling you to not take your medicine. I am telling you simply my experience, and I hope to evoke a response from the audience and get a conversation started. So please understand, this is not medical advice. I am not licensed in any way, shape, or form in mental health or to practice medicine. Just want to get that out of the way. Thank you. That's a wrap.